know about that. So I was just telling Dr. Santosh, maybe this is a subtle hint from me that I'm attending too many conferences. I should focus more on practice. So yeah, conferences, which ones to attend and how to choose. Because if you see your inbox, you will have mails with abstract submission dates for all conferences. There are 22 state ophthalmic conference or state ophthalmic societies in India which have annual conferences, midterm conferences. AIOS now has an annual and a conference coming up in July. 9 subspecialty societies that have annual conferences, midterm conferences. So there are more conferences than there are weekends in the year. So how are you going to choose, if at all you want to attend? And why should you attend is the first question. As a resident, do you need to attend? So I think I was trying to come up with reasons why one should attend, and these are the 5 reasons why I thought I should attend. The first being to present your research, which is what a conference is. It is a platform to learn new things, to showcase your ideas, to showcase what you have learned, to learn, to keep updated, to network and to collaborate with colleagues, with people who are also doing the same kind of work that you are, to gain visibility. And finally, even before setting up your practice, you go to a conference to see what is it that you're going to need, what is it that you can buy from the exhibitors, from the trade area, and things like that. So when you have to present your research, the first thing you have to identify is what is it that you're presenting. Are you presenting a case series? Are you presenting your thesis? Are you presenting something that is unique in a single case or a new technique as a video? That will help you figure out where you should present that and choose an appropriate, relevant platform. If it's something very, very focused, you might be better, as in a particular subspecialty, you might be better off presenting that as at a subspecialty meet so that it's broadly accepted. You get to hear more critical comments from people who are leaders in that specialty, versus a large-scale inclusive meeting like this where it may get lost in the midst of, in the sea of or ocean of abstracts and presentations. Then you need to decide whether you want to go from a local, you want to present that at a local or a state or a national or an international conferences. And yes, it is not, attending an international conference during your residency is not impossible or is something that cannot be done. If you plan in advance, you can, and I'll show you how, because that is an international conference is where you are actually out of your, your closed, your department, your cocoon, your comfort zone, and that's where you go out. You have to decide whether you're presenting clinical science or basic science. Say, for example, if you're presenting basic sciences, then a conference like ARVO would be the ideal platform, because you should choose the best and the biggest platform first. Then the other reason to attend a meeting or a conference is to learn or to keep updated. So, before your DNB exams or your MS exams, like they said, there are a lot of preparatory courses and conferences like iFocus, there is Kalpavriksha, IPEP. All of them are very well curated with structured curriculum spread over 5 to 7 days. These conferences are, or these meetings are perfect for going through your entire syllabus and some of them have a lot of hands-on modules incorporated in them to help you just before your exam. So these conferences are based on your need, and that is how you need to figure out what is it that I need. If I need to learn, if at the same time there's iFocus and the next following month there is AIOS, if you feel that you're going to be getting more out of iFocus or IPEP, then you should attend that. Don't go there just because everybody is going to AIOS. To network and to collaborate, you stay connected with colleagues, you learn at meetings. Also, when you present and connect to people, to leaders, to program directors, they will remember your face, and later on when you meet them, as when you perhaps you go for fellowship or something, they obviously will recall that. If you're presenting a paper on a particular topic at a meeting, you can find out what is, it's the perfect place for natural collaboration on similar topics. You can make a series from multiple centers. This time at the Young Ophthalmologist Pavilion, we had a freewheeling discussion on residency, fellowships and opportunities. We had panelists being Dr. Rohit Shetty, Dr. Kasturi, Harsha Bhattacharya, Krishna Prasad, Dr. G.N. Rao, Dr. Bipasha Mukherjee. And it was a complete informal session where People asked whatever questions they wanted to have, that they had in their mind, to all of these. Like one of the questions which normally you wouldn't go up and ask, say, Dr. G.N. Rao was, why do you have a bond after fellowship in L.V. Prasad? We asked that question and he answered it. So these are, a conference like this is the perfect place to network and collaborate and meet. To gain visibility. Why? Because everybody needs visibility. You know, it's all going to help you in the bigger scheme of things. Present well, and you don't know whose eye you can catch for later on. If you're just into practice, again, you want to, you know, have some visibility. If you've just moved to your new city after your residency, you're all set to start a specialty practice in, say, retina. Then you want to present something in retina at your local city ophthalmic meeting, or local annual ophthalmic society meeting, where you will highlight your strength. You can tell the local people what it is, the attendants, the delegates, what it is that you're doing, so that can later on translate into more visibility and work for you. They will, you know, referrals will start. There's no point in me presenting what I do in my city in Bombay at Delhi Ophthalmic Society meeting, because nobody's going to send a patient for a DCR from Delhi to Bombay. So focus where you will be able to get maximum results and benefits. And visibility, you know, if you present, the more you present, the more, you know, in a particular area, the more your face would be remembered. You become, you know, people can put a name to your face. This is 10 years ago when I was a resident and I was presenting at IPEP in L.V. Prasad. That in the Congress, Dr. Santosh Sonawar, obviously he hasn't changed in 10 years. I may have horizontally or vertically. And I presented at the case presentation competition. I won a prize, and 2 years later, I was his fellow. And he was sitting there in front of me at the interview panel. So, and he remembered me from then. So you never know when the connection is made. Finally, you know, why attend a conference is one of the reasons is also before you set up your practice, because you want to buy new equipment, you want to familiarize yourself with what you are buying, evaluate new technology. In fact, this time I was just going around, I saw there's a wide field OCT that captures the optic disc and the macula at the same time, and you can, after capturing, you can then decide whether you want to do an you know, glaucoma analysis or through the macula. So this is new technology. You see more, you learn more. You never know, a question like that may come up in your viva and you can say that, and then they know, okay, oh, this guy is actually updated with things. Understands the costing of things involved and the business of ophthalmology. But you say all of this and I still have to come back and, you know, see patients, do cases, manage the ward because I'm just a resident. Don't be afraid to ask questions. If you have a question in your mind, just being a resident can work in your favor in a big congress. Nobody may know you. You can ask whatever question you want, you have in your mind, and you will get an answer. Don't be shy from walking up to experts in their domain and asking them a question. You know, they may be too busy, or, you know, they may not talk to you or rebuff you, but then what have you to lose? You can speak, figure out what you want to. By attending more and more meetings, by hearing what people are saying during your residency, you may have already figured out what it is that I want to do ahead, or what area of specialty I want, subspecialty I want to do a fellowship in. So you can find your niche early there. And you know, if you've presented multiple papers, a poster, or converted that into a manuscript and got an award in residency, your fellowship chances are boosted. So presenting at conferences during my residency, I never thought too much of it. I was, you know, during fellowship, during my residency, I had a mentor with me who used to trouble me by giving me a lot of work. He may be sitting on the 4th row there. So he made me present at the AIOC 10 years ago. I presented on that day, and on the second day of the AIOC, and I flew back to Bombay. It was in Ahmedabad, and I came back to Bombay where I stay. And then for a particular reason, the reason being I was getting married the next day. And then I got a call from Dr. Rashmin Gandhi saying, you won the best paper award in your session. You are presenting at the Rangachari final. I said, but sir, I'm getting married. He said, I don't care. You have to come to Ahmedabad, present it again. You don't realize the importance of presenting at this forum. I said, but I'm getting married. I have better things to do that evening. So it doesn't matter. So, and of course, at that time, I didn't realize why he was making me do it, but I did. I came back to Ahmedabad, presented the next morning at Rangachari sessions, and came back in the evening for my wedding with him. And now I see that, getting an award really is a prestigious thing. And so you can look back and then realize why that was. Beyond the country, beyond the local area, why do you want to go for an international meeting? Because as much as data is presented in India, international meetings, focused special interest groups are where latest cutting edge science is presented. Even if you're not presenting, the amount of learning that you have by sitting through those sessions is immense. And if you're actually presenting, then the prestige of an acceptance or an award, possible award at these meetings is even more. By engaging the presenters, by asking questions, the setting at international conferences generally a little informal, far less, and people, there is a specific time dedicated for question answer. It is more structured, and you can ask whatever questions you want, and usually you get an answer. You never know, there can also be future collaboration opportunities. So these are in general the reasons why to attend a conference. Why not to attend a conference is just because your friends are going, because it's in a nice place, just because you want to go. And eventually, even if you're attending, try not to go without presenting. So you should present whenever you attend a meeting. So finally, when you've decided to go to a meeting, plan in advance. Go to the website of the Congress or the meeting. Figure out who is coming, which are your areas of interest, what do you want to see. Now, this time at AIOS, we had the innovators session, which is where you always see something new and figure out what are new people doing differently. Figure out which sessions you want to go to. Plan that out beforehand so that you don't go on the day of the Congress or the meeting with that paper in your hand, figuring kahan jaun. Prepare a ready, up-to-date CV with you and keep. At international meetings, you have multiple universities as well in the trade area. You have organizations like Orbis. So you never know, when you make a connection, you give them your CV, they may even hire you. So there are opportunities like that may happen. Fellowships can click through that way. And always visit the trade area. In general, always I've tried to make sure that I learn at least one thing that changes the way I practice here. So whenever you present at a meeting, the conference abstract that you present must be converted to a paper, and you have all the resources that Dr. Sabyasachi Sengupta said you can utilize to do that. Your thesis should be presented by every resident. The AIOS has the ARC thesis presentation competition, which is essentially there to enable you to present that. And while it is good to sit through sessions like court martial and the free papers is where maximum learning happens, and you get ideas as to, okay, maybe I can also devise a study that way. So you can make a checklist, aim for the conference that you want to go to, plan in advance, make your abstract, submit it, book the tickets, and that is where you have to be a little more resourceful. And I've picked up a lot of these names from a document that Devakant had made about travel grants. So there are, each conference, almost every conference has some travel grants allotted for it. If you're planning to go to the Asia Pacific Academy of Ophthalmology, there are two sets of travel grants. Usually the host country has its own set of travel grant. The APAO itself has a travel grant, the Professor Yaso Tanao travel grant. If you're planning to go to the APVRS, the Asia Pacific Vitreoretinal Society meeting, which was this time in Seoul, South Korea, they had a travel grant of $1,000 for 10 students, 10 delegates, and they are specifically aimed at people under the age of 40. I believe the Korean Ophthalmological Society, for their annual meeting, also has a travel grant of $1,000 for 10 people who want to attend. And if you all do want to, you can get in touch with Devakant. He can give you more on that. The Asia Pacific Society of Oculoplastic and Reconstructive Surgery also has an travel grant of $1,000 for 10 delegates who want to attend and are under 40. ARVO has travel grants. The ICMR, Indian Council of Medical Research, has a travel grant. The Science and Engineering Research Board has a separate a wing which looks into proposals for travel abroad for presentation purposes, where again they give you travel grants. Also, you can earn your travel grant by presenting at the AIOC ARC thesis competition. The first price usually is a fully paid trip, including conference registration and travel to AAO and ESCRS, and the next subsequent AIOS as well. This time the AIOS YOC writing competition had travel grants for the subsequent AIOC. So there are always ways and means you can maximize without spending too much as well. So in summary, planning is important. Don't think of conference as just another trip or a holiday. Sure, you have to go out a little, do a little sightseeing and things like that, but don't let that be the focus of your meeting. Align your goals so that you find you can get the most out of the appropriate platform, and of course enjoy at the end of the day, because your residency doesn't come back. Thank you.